34 million people have HIV or AIDS, but it's no longer a death sentence, is it?
No, it's not. There have been a development of therapies over the last several years, beginning with the combinations that were available in 1996 until the present time, that have really transformed the lives of HIV-infected individuals, so that if you can get people on therapy and they stay on therapy, they have almost a normal lifespan, which is wonderful for them to save their lives, but also it brings down the level of virus in their body so that it makes it very unlikely that they would infect other people. So those advances in therapy have both been good for the health of people as well as to prevent HIV infection.
Now, since 2005, AIDS-related deaths have decreased by 40%, but that's not the case for children between the ages of 10 and 19. How is that being addressed?
Well, right now we need to get more drugs with formulations that are applicable to children. We've done a very good job in the developed world to prevent the transmission from mother to child. We're doing much better in the developing world by essentially treating the mother who is infected and treating her through pregnancy and essentially for the rest of her life. It's called the option B+, even during breastfeeding. But when you have babies who have unfortunately gotten infected, often we don't get them on therapy soon enough. And the trend right now is to treat babies as well as adults as early as possible following the diagnosis of HIV infection.
Now, as we saw earlier, Prince Harry is trying to raise awareness, and he is one of the high-profile people helping to, I guess, reduce the stigma surrounding AIDS and HIV. How important is it for people like him and people at high profile to address this?
It's extremely important. We need to decrease and eliminate the stigma associated with HIV, because stigma works in many insidious ways. It really interferes with people coming forth to get tested. When they are tested, if they turn to be positive, a stigma is very difficult and makes it difficult to get these people under proper treatment and to get the proper kind of care in the community. And people who aren't infected, just the idea that you're practicing the kind of sexual activity which puts you at risk, instead of getting counseled, if there's stigma against that, people don't get the right information. So stigma is extraordinarily destructive on so many accounts.
Now, you've spoken about the hope of finding a cure. What are the stumbling blocks to that? And is the focus more on a vaccine?
Well, it's both. Certainly a vaccine would be very important. We still have 2.1 million new infections each year. We're doing better, as you mentioned. Less people are getting infected, less people are dying. But if you really want to completely turn around the AIDS pandemic globally, an effective vaccine would be very important, and that's why we're working so hard to get one. A cure would be a bit more problematic. We can get people on therapy, and they'll do fine, essentially, with a normal lifespan. By cure, you mean someone no longer needs to take antiretroviral therapy, essentially either eliminating and eradicating the virus, which is very difficult given the characteristics of HIV, which has the capability of inserting itself into the actual chromosomes and genes of cells, make it very difficult to eradicate, or to get people in remission where you boost their immune system, and when you take them off antiretroviral therapy, their virus does not rebound, because even when people are doing well, when you stop therapy, almost invariably, the virus comes right back. The good news is when you put them back on therapy, the virus goes back down to undetectable.
A very difficult challenge there. Dr. Anthony Fauci, thanks so much for joining us today. We really appreciate it.
Good to be with you.